Am I audible? Okay, we start the meeting. You can message me out. I'll be just seeing the messages and question answers. We'll take it at the end for 10 minutes. Whoever has any questions regarding this session or any suggestions, we'll be doing that later on. Today morning, I was reading a book on Rumi. Maulana Rumi is from Turkey, about 16th century. He was a Sufi saint there. There was a very beautiful line in the book which said, if you cannot challenge yourself, you will do the repeatedly things. I mean, if you have to, the meaning of the line was, I'm sorry, I'm missing little words in that. Uh, the meaning was that if you have to change yourself, you'll have to challenge yourself that you have to agree yourself that we have to make certain changes. If we do not make certain changes, we will do whatever we are doing over the years, we'll have the similar results. We cannot expect different results. By doing same things, we cannot have different results. So as a company, we are trying to innovate and give you newer molecules so that whenever we go to the doctor's chamber, even if we get 10 seconds, 20 seconds, the doctor listens to us, what we are trying to say. That is the change we are trying to make. So if whatever is there, you have to speak to the doctor, there is a need that we all must understand what the product is. So this is an effort to do that, the third effort to do that. And I'm very happy with the encouraging last two sessions, which you have started taking the products, adding new products, and they are getting good response from the market, which I could speak to some of you. And today, as we are very well aware, about 10 years back, there was a lot of, on the vitamin D3, there was a huge cry that in 98% of the Indians have vitamin D3 deficiency. 98% of the Indians, jabki hamara subcontinent is where we have plenty of sunlight. So still we all are 98% Indians are D3 deficient. Similarly, when the studies went, B12 deficiency is there with 70% Indians. Now this month, this session, we are talking about magnesium. Now magnesium, if you, I'll just share you the data. Urban populations, people who are living in cities are called the urban population. 50 to 70% have magnesium deficiencies. Fast food habits, stress, processed diets silently deplete magnesium levels. Elderly patients 60 to 70, patients who suffer from diabetes, more than 70% of them have magnesium deficiencies. Pregnant mothers, 40 to 50% higher magnesium. There's a very clear data. If the pregnant mother has a deficiency of magnesium, so the kid which will be born will also have a deficiency of magnesium. Now, all of these vitamins have a challenge of absorption in the market. MGBD is the product name, is a premium nutraceutical designed to address one of the most widespread deficiencies in modern population, magnesium. It contains a powerful combination of three highly bioavailable forms of magnesium. See, bioavailability, we have to understand in a very simple language. Then what is bioavailability? See, when we two people are speaking different language, the other does not understand. Similarly, the body speaks a particular language which it understands that this is a vitamin which is to be absorbed. This is a product which has to be excreted through urinary or excretory system. So what happens is the bioavailable form is a language which a magnesium will speak to the body, where the body will understand this is magnesium and it will absorb. So the higher the bioavailability, the higher will be the absorption of magnesium and the higher will be the magnesium deficiency. So what we have combined three forms of magnesium. One is magnesium glycinate, aquamarine magnesium. Then we have the liposomal magnesium along with vitamin D3 and B12. Magnesium deficiency extremely common. Effective estimate 50 to 70% of the adults. Factors like poor diet, stress, caffeine intake, medications like PPI, diuretic, and sedentary lifestyles reduces the magnesium stores. So the magnesium is not absorbed. So what are the patients who are magnesium deficient? What do they complain to the doctor? Muscle cramps, fatigue, poor sleep, stress, anxiety, irritability, headache, or migraine. Magnesium is even considered to be helping in migraine also. Numbness and tingling, weak bones, low vitamin D response, and metabolic imbalance. See, what MGBD contains is an elemental magnesium as a form of magnesium glycinate complex 120 mg, elemental magnesium as aquamarine magnesium 198, elemental magnesium as liposomal. The aquamarine is a product which comes from Ireland, and liposomal is comes from Czech Republic. And the magnesium glycinate complex is an amino acid forms which the body understands better for absorption. So there is a higher bioavailability of process which will be used by the body as a magnesium. Vitamin D3, vitamin B12, magnesium glycinate complex. It has the highest absorption among all magnesium forms. Minimal gastrointestinal upsets. Magnesium, iron, copper, all these complexes, they are considered to have an gastrointestinal upset. When a patient take, they have a GI irritation. But with this forms, amino acid forms, they don't have, the glycinate form does not have a gastrointestinal upset. Excellent long-term tolerability. So it has a superior absorption, ideal for patients with GI sensitivity, supports stress and anxiety management, improves sleep quality, effective for muscle cramps. Now, next one is an Aquamin magnesium 198 mg. Aquamin comes from a red algae, a natural marine mineral complex. It contains major quantities magnesium. It contains calcium also. It has 74 trace minerals also. Red algae is considered to be one of those favorite as an antioxidant with Japanese people. We have a research paper which says that it increases the bone mineral density, joints comfort, digestive health, cartilage integrity, and reduces joint stiffness. Better tolerability and gradual releases. It is a unique porous structure, ensures a slow, sustained release of minerals leading to enhanced absorption, reduces risk of gastrointestinal upset, and consistent mineral delivery. See, the liposomal technology, last time also we done, it is encapsulated in a form of a drug delivery system where when it enters the body, there it is released. So it has a maximum viability, ideal for neurological support, migraine, stress-related disorder, poor concentration, and nervous system issues. Patients with low magnesium response. Then we have an added advantage of vitamin D, vegan 600 IU, vitamin B12 2.2 mcg. These two are in a small quantity so that they help the absorption of magnesium in the body. So this is your pack where MGBD, triple magnesium, magnesium with vitamin D3, influence VDR building, clinical conditions where doctors prescribe MGBD. It is muscle cramp, restlessness legs, post-exercise soreness, insomnia, stress patients, anxiety, headache, migraine, numbness and tingling, osteopenia, osteoporosis, arthritis, vitamin D deficiency, metabolic disorders, diabetes, fatigue, metabolic syndromes, cardiovascular people, hypertension and palpitation related to magnesium deficiency. So what is the advantage with MGPD? See, here you can understand with the kind of the broader who can prescribe the muscle health, the ortho, the stress and sleep, MD physicians, neurologists, ortho people, metabolic disorders, cardiovasculars. So there is a high scope that all the doctors of your list, if you introduce, they have the potential to prescribe. So now, what again we are talking about the multi-source advantages of MGPT tablet, multi-source magnesium with scientific backing, clinically research equipment, liposomal technology, complete bone, nerve, and muscle solution, excellent tolerability, very safe on the gut, no GI interaction, clean and modern formulation. So what is that? The takeaway, we can just summarize it. Triple magnesium advantage, super absorption, excellent tolerance and powerful potency, clinically proven equipment, targeted support for robust bone and joint, liposomal technology, gentle and safe, B12 and D3 combined for the synergetic effect of magnesium, comprehensive relief it gas. So how do we conclude? MGBD is not just another magnesium supplement. Because if you tell them it is a magnesium, they may listen, they may not listen. You will have to tell them it is not just another magnesium supplement, it is a premium, multi-action, scientifically designed formulation, offered broad spectrum benefit of nucleomolecular skeleton, metabolic, and neurological health with three advantages forms of magnesium, along with synergetic effect of vitamin D and B12. So we have seen that all the doctors who have been prescribed, who we meet, can prescribe our magnesium MGBD. So I'll just show you the pack size. Even the pack size has this. This is 1 into 10 into monocarton. This is the monocarton which will go to the patient. I hope it is visible to everyone. You can just write a comment on it. Hello, pack. So this is the support which we'll be giving. This is your packaging. We have a 4-page LBL which talks about the efficacy of the brand. It is from Ireland and Czech Republic, the raw material where we have bought. We have even shown the liposomal magnesium. We have this promotional input. We have a doctor's pen also, MGBD, which you can give it to the doctors. The advantage of this torch, it comes with this kind of a packing. It has a USB where it can charge the torch. This is your torch. You can adjust, the doctor can adjust the focus. Then we have three modes into it. One is that where you have a reflection. Then second is in case of emergency, you can use it as a torch to work. This is the physical appearance of the pen. The MRP is 380 rupees per strip for 10 tablets. Till Monday evening, we have a scheme for you where we have 10+1 offer with you. The LBLs, the physical LBLs, the pens available for you, 10 pen, the physical 10 LBLs, and the scheme is 10+1 to launch the product. And if you have a higher quantity, you can just speak to the salespeople for any further. We shall be happy to support you in that. I hope things are clear for MGBD till today. Whatever we have spoken, it is a very powerful formulation where you have three kind of very high bioavailable magnesium into it. And the magnesium, when you will talk to the doctor, everybody will say that, yeah, we need magnesium. So I think we move to the second. Yes, it is safe in pregnancy, but we'll have to see whether the data available for magnesium and what is the requirement for magnesium. We'll have to dig into some studies for pregnancy. Thank you, Jerry, for appreciating the packaging and the content. See, another major problem in the Indian market with the urban population is regarding the joints, the knee joints, the osteoarthritis. So another feather in the cap, we have a product which works on the knee joints. We'll just take you through that. Just a moment. This is a formula for what is Tandorix. Tandorix is an advanced formula designed for comprehensive joint care. It provides an essential nourishment and a robust cartilage protection, working synergetically to reduce the joint pain, significantly improves mobility, and supports long-term joint health for an active lifestyle. See, these days, Indian population, people who are as young as 45 are having problems with their knee joints. Specifically target three critical areas of joint degeneration. What happens with the joint? There is a poor blood supply, addressing is insignificant nutrient delivery to the joint tissues. Since there is no proper blood supply, so there is a deficiency of nutrition to be delivered at the joint tissues, protecting and supporting the regeneration of damaged cartilage. These cartilages which are there to support the joints, they get sometimes damaged, teared off, loss of lubrication, restores. This is the synovial fluid here. The synovial fluid for smooth and frictionless joints, so that are both the joints. See, if you have these synovial fluids here, and if the fluid is reduced or the density is less, the bones will touch to each other and there is a pain. So Tendorix goes beyond mere pain relief. It actively repairs, rebuilds, and protects the joint from within, fostering enduring the joint wellness. So what does it contain? Per tablet, collagen peptide type 1, which is for the joints, 40 milligram, chondroitin sulfate, sodium 200 milligram, sodium hyaluronate 30 milligram, L-arginine as a sustained release is 500 milligram, and vitamin C 35 milligram. Now, what are the roles of these? Collagen peptide 40 milligram helps in cartilage regeneration and reduces the joint pain. Main building block for bones, cartilage, tendons, and ligaments. Helps repair damaged and joint tissues. It helps repairs the damaged and joint tissues. Improves joint strength and elasticity. Rebuild joint structures from inside. Now, what does chondroitin sulfate sodium 200 milligram does? It is a natural component of cartilage. This cartilage, this one, it prevents the cartilage breakdown. It acts as a shock absorber in the joints, reduces joint pain and stiffness. Then you have the sodium hyaluronate, provides joint lubrication, improves smooth movement. It reduces the friction between the bones, maintains synovial fluid quality. The hyaluronic acid also helps for lubrication of this. L-arginine sustained release 500 milligram. What happens is L-arginine does in blood circulation by increasing the nitric oxide. So it dilates the veins and the nerves. Better blood flow means more nutrition reaches the joints, help faster healing and reduces the inflammation. Sustained releases ensures long-lasting effect throughout the day. What is vitamin C? Essential for collagen synthesis. Protects the joint from damages caused by free radicals. Act as a powerful antioxidant, protecting the joint cell from oxidative stress and inflammation. Supports the body's natural healing process and tissue repair within joints. We have seen the formulation. We have studied the individual part, collagen, chondroitin sulfate, sodium hyaluronate, L-arginine, vitamin C. Now, what does this combined effect? Individually, we have studied. What synergies do they produce as a combined action? Why Tendorix is different? It improves the blood supply to joints, restores the cartilage strength, enhances the joint lubrication, reduces pain, stiffness, and inflammation. So it improves the mobility and the quality of life, not just pain relief, complete joint care. Indications where the doctor will use this product: osteoarthritis, elevating pain and improves joint function; knee joint pain, reducing the discomfort, restoring mobility of the patient; cervical and lumbar spondylitis, managing pain and enhancing spinal flexibility; sports injury, supporting faster recovery and preventing reoccurrence; age-related joint regenerations. Post-surgical joint recovery, accelerating the healing and optimizing the rehabilitation. Chronic joint stiffness and pain, providing long-term relief and improves quality of life. What is the dose? One tablet once daily, as directed by the physician. Sustained release L-arginine ensures a day-long benefit. So, what are the advantages we have for the doctors? The multi-mechanism joint support, sustained release technology of L-arginine, safe for long-term use, addresses cause and supports, better patient compliance. What does the patient benefit gets? The less pain, better in movement, easier walking and daily activity, reduced dependency on painkillers, and improved joint efforts. Dr. Tendorix is a complete joint solution. It improves the blood flow, repairs cartilage, lubricates the joints, and restores the movement, not just temporary pain relief. So, what is the promotional material we are talking here? This is the LBL, the leave behind literature, which talks about the formulation, collagen, advanced formula. This is the pen which is there for the doctors to prescribe. Till Monday evening, again, there is an offer for all of you. 10 plus 1 is the offer here, which we are providing for Tendorix, so that you go to the market. And thank you, Manasi, for having a trust and telling us to give us a 10 box. Will it repair damaged cartilages? Yes, it will repair the damaged cartilage, but sometimes it is depending upon the patient's condition. There should be some cartilages left so that there is a scope of improvement. If the cartilages are not there or it is totally tear off, then sometimes it becomes, it's a surgery case. There the patient has to be operated for the. Thank you very much, sir, for working on MGPD, and Tendorix is a good one. Thank you very much. Thank you, Manas. I know the faith you all have in Genesis product. We have given it to one of our staff members here, and she was suffering, and now it is better. She's almost cured from the knee pain. So these are two. I can hold out for some time if you have any questions, because now the major training session for these two products were there, and now I just wanted to show you one more, the range of products which we have for vitamin D3. Vitamin D3, it is called a vitamin of sunshine. Vitamin D3, we've been working over years. You all have been using it very nicely and promoting it to doctors and getting a good sales from it. But I'll just like to show you the trusted healthcare partner Genesis with strong market presence. 98% of the Indians have vitamin D deficiency. Now, what is there is vitamin D is a fat soluble vitamin. It is naturally synthesized in skin and exposed to sunlight. Plays a critical role in calcium and phosphorus absorption. Vitamin D plays a role in every metabolic activity in the body, particularly for calcium and phosphorus. People who have low vitamin D, I would request you that all of you should get your vitamin D checked, because if your vitamin D is low, you'll have one or the other ailment in or the problem. You can have a weak immune system also. The muscle function can be weak. Strong bones and teeth you don't have. So what is there is that there are different kinds of products. 90% of the urban population is more affected than the rural population because they get very less sunshine. They are running to wearing full sleeve shirts and they're running from the sun. How does vitamin D work? Vitamin D is absorbed from the skin, then it is synthesized in the kidney, and where it is converted, and then it is synthesized in the liver, from where it is transported. Vitamin D is converted to active form of calcitrol in the body, enhances intestine absorption of calcium. It is maintains a serum calcium level, promotes bone mineralization, muscle strength, and neuromuscular functions. So if you see, almost all the doctors are prescribing. See, what is the dosage forms which are available with Genesis? That is the important one. We have soft gel capsules, we have sachets, we have oral drops for kids, we have injectables also, we have nano shots also. I'll just show you through that only. See, these are the ranges which are available. These are D3 drops where we have 400 IU per ml and 800 IU per ml. Then we have soft gelatin. This is a vitamin D3 injection. Wait, I'll just show you all of them later on. We'll go through soft gelatins. We have one brand more for soft gelatin. Then we have the sachets. These are the nano shots. These are the nano shots again in a residue format. This is another 800 IU. This is another nano shot which we have. This is another form of a nano shot. Then we have this Tri-T3 soft gels. So these are the literatures which are available. I'll just show you. You can see the 400 IU. This is the 800 IU we have. These are the nano shots. One time 60,000 IU. You can see the packagings. We have one. Some doctors say we want square. Some say we want oval. We have all of them. This is the oral. We have this form also. When the patient has to just open it out and take it one. Silica cholecalciferol injectable form. Each injection contains 6 lakh IU of vitamin D. 6 lakhs IU, where the patient has a very severe conditions. There, these injectables, these are, you can just see it is 6 lakh IU per ampule. This is the sachet form. Some doctors still prefer the oldest one of the sachet. So starting from 2-3 brands of D3, then we have 60,000 IU, then we have drops for kids, injections, sachets. So I think all of the doctors these days are prescribing. Wherever you have a very high volume of D3 consumption, you can ask for this, any special offer from the sales team. So the Tendorix MRP is 350 for this pack of 10. You can see how beautiful is this strip. Even where you can mark the patient's prescription when he has to take it is morning, evening, or in the night. You can see the prescription marks. Thank you very much. Now you can unmute yourself and raise your hand if there is any questions or query. I'll just try to note down any suggestions and we can work on it. That what is your requirement? We can work out on it. रुकिए हेमंत जी, आवाज आप अपनी अनम्यूट कीजिए. हाँ, अब हुआ.
Can we give together MGBD and Tendorix?
Yes, we can give together. There's no problem. दोनों constituent different है. Both the constituents are different. We can give.
Evening, morning, we can.
Yes, we can give. There is no problem into it.
Right.
If we go and try to tell them that we have a magnesium, they will not write. We'll have to tell them there is something special in magnesium, where the bioavailability is higher. For a joint care, we'll have to take some time to them to explain them. Yes, Jerry, you can try now.
Is triple magnesium for the first time in India?
No, there are other brands of products of magnesium in India. Lot of brands of there on magnesium, but the triple combination is very few, where you have the liposomal, the aquamine, and the amino acid form of magnesium. Jerry, for MGBD, there is no direct competition. Which has the similar kind of formulation with magnesium and BD, B12 and vitamin D. Anyone else can give me some suggestions or, yeah. Who wants to speak? Everybody is free. They can give their inputs. There's no problem. नवोदय जी कुछ बोलेंगे आप? You would like to share something?
सर ऐसा इनपुट तो ऐसा कुछ है नहीं. एमजीपीडी आई एम प्रमोटिंग और डॉक्टर्स को भी पसंद आ रहा है. पैकेजिंग इज ऑल्सो गुड. इट्स जस्ट दैट द जो आपने अभी बताया है दिस हैज बीन वेरी हेल्पफुल. वो आगे प्रमोट करते हैं द
Thank
यूज
you.
ऑफ विटामिन B12 एंड विटामिन D3. तो ये और बताते हैं उनको सर.
ठीक है. Tendorix is also a good product. You should try that also to for patients with especially with physicians and orthopedicians.
तो टेंडरिक्स ऑल्सो सर अब मंगा के उसको प्रमोट करते हैं बिकॉज अभी तो हमको ही अंडरस्टैंडिंग नहीं थी प्रोडक्ट की. तो आज
Okay.
आपने बताया उसके बारे में. हाँ.
Vitamin D also we have an entire range. So whatever your doctor is asking, you can pitch them that we have sachets, we have uh, any kind of vitamin D which they want, we have that.
So वो ऑलरेडी यूज कर रहे हैं कार्गो नैनो शॉट्स. आई एम ऑलरेडी इन ग्लास फॉर्म वी आर यूजिंग एंड दिस सॉफ्ट जेलेटिन कैप्सूल वाइटल कार्ल 60K.
Thank
So
you.
that we are already promoting and getting distributed in the market.
Okay. Yeah, anyone else? Maniji, would you like to share something?
Yes, yes. Is it audible, sir, now?
Yeah, please, please.
Yeah. Thank you so much, sir. Your presentation is really
Thank you.
good. And no, the best part of Genesis is the quality and the package, because that makes us, different from other competitors, players. And as you rightly said it, the moment we are going to promote the product as a simple magnesium, then doctors may not pay the attention, because we have to tell them the unique selling point, the source of magnesium, the bioavailability of magnesium, and how it is going to helpful to the patients. The moment we are going to talk to these points, then doctors will pay the attention, and we are higher chances of getting a prescription from the doctor. That is how we should understand the product properly, and have a good interaction with the doctor. Whatever the little bit time we have, then we can expect the parcel. That is the best part I learned from you. Thank you so much for your inputs and presentations.
Thank you. Thank you very much for joining. We appreciate your patience for listening us, and it should be helpful in the field also.
Yes, definitely. It's a
Thank you.
continuous process, sir. Learning is a continuous process.
Yes. Thank you.
Thank you, sir.
See, Jerry, the product is very good. When we got the first batch of this product MGPD, I would like to share one personal experience with you. I had a little pain in my calf muscles. Maybe due to dehydration or maybe due to any reason, I do not know. But I had a calf muscles. I had a little pain in my calf muscles. So I took just 4 tablets. I took it to my home. I started taking it. And after 4 tablets, I got a relief that I didn't require the 5th tablet. That is my personal experience. And the product is excellent. We are honest people. As a company, we have an honest philosophy to write the product or the ingredient, whatever is written, we will put the exact quantity, so that our winning situation will come when the patient will come, he'll take this and he says, I want this strip only because I'm getting a relief from this. That is my winning. That is the strategy which we have. The patient should carry our product and ask for it. We want this only. Thank you, Jerry. Thank you very much. He prescribed MGBD along with it. You can share the experience. If you want, you can share the experience. Yes, sir. Thank you very much. One of my doctor prescribed MGBD along with EAL capsule, 2 and 2D DM patient. And he's got results in 2 days. Very great news that the result is in 2 days. Thank you for sharing it. Thank you, Jerry. Thank you once again. अच्छा, हिमांशु जी आप लाइन पे हो? हिमांशु शुक्ला जी, या आप अनम्यूट कीजिए.
जी सर.
हाँ हिमांशु जी, आई वुड लाइक कि आप शेयर करें अपना एक्सपीरियंस जो
सर
आपने लिखा।
एमजीबीडी मैं लिखा बताया ना, मेरे डॉक्टर ने प्रिस्क्राइब किया था एमजीबीडी अलॉन्ग विद ई ऑल।
ओके
तो उसका उसका काफी अच्छा रिस्पॉन्स मिला है उसको, पेशेंट को।
ओके, चलिए थैंक यू।
तो अभी मेरे एक दो डॉक्टर्स ने एमजीबीडी वो प्रिस्क्राइब करना शुरू कर दिया है।
वेरी गुड।
दे आर द बिग शॉट्स ऑफ कानपुर, एमडी
ओके
मेडिसिन ऑल। तो
वेरी
उन्हें
गुड।
प्रोडक्ट काफी पसंद आया है। और सम ऑफ हमारे कुछ गायनी डॉक्टर्स हैं जिन पे मैं ये काम कर रहा हूँ, मोस्ट प्रोबेबली वहां से भी बहुत जल्दी रिस्पॉन्स आ जाएगा।
ओके, तो गायनी गायनी में मैग्नीशियम का अगर वो कोई डाटा बोलते हैं तो यू कैन आपको मैं डाटा भी प्रोवाइड कर सकता हूँ।
हाँ सर, दे दीजिएगा। तो अभी तक तो मैंने गूगल से जो स्टडी करी वही बताया था। हाँ, तो उससे आपसे अगर कुछ स्टडी मटेरियल हो तो प्लीज मतलब दे दीजिएगा,
ठीक
प्रोवाइड
है,
करा दीजिएगा।
ठीक है,
ओके सर।
थैंक यू। थैंक यू हिमांशु जी फॉर शेयरिंग योर एक्सपीरियंस। थैंक सर वन मोर sir, you would like to share something?
Yes, sir. I'm audible, sir?
Yeah sir, tell me.
Yeah. See, now this 2025 November onwards, I joined my hand with your organization.
Thank you sir.
Uh, from last month onwards, I started. Now, in this 30 days of tenure period, because of shortage of stock of MGBD, even though I promoted to the doctors around 100 boxes. MGBD,
Great,
only
great, great.
single person.
I think he requires a very good hand, and it is a very great effort for giving 100 boxes from one headquarter. Sir, thank you very much for the faith.
Yeah. Today also I placed 2 cases of 48 boxes.
Okay. The
Order.
stock is available now at the
Yeah,
CNF.
now available. A little bit
Yes,
this distribution disturbances came. I got that information.
thank
Very
you sir.
shortly, I'm planning to 300 boxes per month and 500 boxes. That much scope is there for this product, particular product,
Great, sir.
MGBD.
Great, great. I think it is a very good starting or very good thought process you have. See, what is the potential? That is what is the potential. 300 boxes, 500 boxes, one headquarter.
Yes,
Great,
yes,
great, great. So
yes,
thank you very
definitely,
much
sir.
for the faith in Genesis.
Yeah, and also my CNF, I think you know very well. He supports very well
Yes,
by sending the stocks in time. Great support from the organization and the distribution point also.
yes,
And one request, sir, regarding marketing.
yes, sir.
We are getting these LBLs for gynec segment, Nutra Wellness and Genesis and respiratory division and ophthalmology division. Can we expect ortho division products, LBL, all
Yes,
products at
yes,
one page?
yes. We'll note it down. We'll do that, sir. We have made a presentation on mobile phone where we can
Yes,
give
sir.
you that, and we'll develop a glossary also for that, a printed glossary
So,
for that.
yeah, my personal request, sir, is a glossary is a ethical promotion company. People, doctors will think. As
Yes,
per, I'm having a 30 years of experience in the pharma marketing.
great, sir.
Yeah, I worked for different organizations of Indian MNCs, and also my sincere request for that glossary.
Fine.
See, it is
We'll do
useful
that.
for
We'll
yes,
do
sir.
that on urgent basis, and as soon as it is printed, we'll share to the CFA. We'll send you, sir.
Two more, sir. In the app, Genesis app, Nutra Wellness products is not unable to download. We are unable to download. And also
I'll
Nutra
just check the
Respiratory
app once
also we are
again.
unable. Yes, sir.
We'll just check the app once again, and we are doing for. I'll just like to add, since it has come,
Sir.
we are doing an experiment. 2-3 our channel partners have requested for an this tablet, and we should load the app and send it to them. We are doing that for 1 or 2 partners. Let me see how successful it is. So we'll offer that facility to everyone.
Yes, sir. My request is strengthen our hands, sale will come automatically.
Thank you. I'm always there, sir, with you. I'm always there.
Thank
I
you.
would even love to work with you in the field. I'm a man from the field only.
Most welcome, sir. Most welcome. Most welcome.
I would someday love to come, and only the
Welcome.
time shortages and those challenges are there with me. Otherwise,
Yes,
we'd
sir.
love to work with you in the field also.
Yes, sir. Okay, sir. Nice talking
Thank
with you,
very
sir.
much, sir. Thank you for the input,
Thank you,
sir.
sir.
Thank you.
Thank you so much.
Thank you. Thank you, everyone, for appreciating, and thank you for joining once again. My pleasure. And I would request you to give your feedback to the sales team and what products you want future to be taken up. We'll do that also.